So, good morning, everyone. Morning, everyone. Oh, yay. Good. Thanks for hanging in there with us through this last session. We're reminded we're between you and horse racing, but we'll try to make this, I think, a combination of interesting on these different cases and some fun as well. And my job is just to sort of kick things off, to give you a high-level view of a few of the key issues that we'll be talking about through really what our stories and case studies from four different sets of partners across 4 states. And so the theme of mine is we're doing the mixed metaphors today, I think. This is, if it works for corn, why not for public health? Okay, that's my title. Now, it's gonna work, it's gonna make more sense. Anybody here grow up on a farm? Oh, so quite a few. So those who grew up on a farm, this is probably gonna make more sense. The focus we want to talk about is this translational focus on evidence-based decision-making. And there are a few core elements in our 4 cases around networks and partnerships and their importance in this field of public health services and systems research. Oh, I've got an automatic thing built in here. This is going to move me through every 15 or 20 seconds, I think. Quality improvement, which you'll hear about as well. Finances and financial management, which is critical to effective public health, and policy translation. And so we'll walk through a little of these. There are many definitions out there around evidence-based public health, and I like this one because it's one sentence and it's simple in what it says, but it's also got a lot underneath it. So it's a process, not a rigid set of things, but a process that has to be fluid and has to move through. It allows us to integrate science-based interventions, the kind of work going on here with research, along with community preferences, with obviously the ultimate goal of improving health in the population. Okay, so that's Neil Kahatsu's definition from a few years back in American Journal of Preventive Medicine. Another part that might link even better with PHSSR is what we're calling administrative evidence-based practices. These are things like workforce development, leadership, organizational climate and culture, relationships and partnerships, and financial management. Hold on to that one. These look at health department structures, activities, processes that are now being associated with performance measures like achieving core public health functions, or carrying out evidence-based interventions, or showing some progress within a state or local health department, for example, in moving things forward. This next one is going to work better for people who are 50 and older. Anyone know who this is? Does that look familiar? Yeah, somebody said Hank Kimball. Okay, so those grew up on a farm. Who's Hank Kimball? What did Hank Kimball do? Green Acres, that kind of nerdy show from the late 60s. But what was his role? Yeah, he was the extension agent. And so why does Hank Kimball matter? Well, he looks surprised for one thing. But he matters for public health because an extension agent is the one who connects agricultural research with the farmers. And Hank Kimball, to me, epitomizes the theory of diffusion of innovation, which is this connector between a new innovation, the kind of work you're doing in learning about what makes public health better, and connecting it with the users of the research, who are the practitioners and policymakers. And that's why Hank matters. That's why we think Hank is an important topic for future research in PHSSR. The background on diffusion theory goes back into the 1940s, largely developed in Iowa, especially at Iowa State University, and really started out the formal parts of it written down by Ev Rogers, who was just a great researcher and grew up on a farm, and like most of us do, sort of observed things going on, wrote about them, and then putting them down in a systematic way that became a testable theory. Basically, diffusion of innovation is the theory. It had a diffusion system that had to be in place around these farmers. It is now being applied more and more frequently in health and public health. The main model here was the extension agent. It was Hank Kimball. Maybe not Hank, but someone like Hank, maybe a more competent Hank Kimball. But the model can be expensive. If you have to put out an extension agent to link every researcher to every practitioner, you can imagine it could be very expensive. But it's very critical to our work. It's what Tom Frieden talked a little bit about, where we're trying to connect the discovery of research to the users of research. And that middle part of that pipeline is often not very well described and not very well done. We're going to hear today from New Hampshire about some partnerships and networks. And here's a farming network for you. That one, the person here, this is farmer number one. You probably can't read the number, but this is kind of your research nerdy guy who likes to read, who connects up to the scientists over here in Iowa State University. That's the scientist who's got a new method for crop, to increase crop yield. And you can see here, this first innovator, this is the innovator, is connected here, but he's not connected to very many other farmers. But then over here, this is the popular kid in high school. This is the opinion leader, and this person is connecting up to the innovator, but look at how many other networks he's connected to and how many other farmers. And that's basically how the concept of network analysis and partnerships. And to be successful in our work, we need both. We need the innovator and we need the opinion leaders, and we need the ways to connect up these networks. And that's the sort of thing we'll hear from New Hampshire. The other thing you see with diffusion theory is some kind of a diffusion adoption curve like this. And really, the way I think of it is most of you are over here. You're innovators and you're early adopters for the most part, the people in this room, the practitioners in this room. The trick, though, is that the majority of people lie here in the middle, and then these, they used to call them the laggards. They're the hardest ones. But what we've got to do is figure out ways to connect this research to get from these innovators and early adopters and opinion leaders to this bulk under the bell curve, okay? And that's kind of our critical choice. A couple of other important concepts from diffusion theory are here, and there's more than this, but for example, for an administrative evidence-based practice to really work, it's got to have advantages over our existing practice. We've heard about that already in the meeting. It's got to be compatible with our organizational climate, culture, and the incentives within mostly in public health in a public agency, where we don't have the same financial incentives that we would in private sector. It can't be too complex. It has to fit the skill sets of the practitioner who will implement the practice, and it has to show some positive changes. We have to be able to observe what's going on and see that. So these concepts came originally from farming, and now they're being applied more and more in public health practice, okay? Another one of our concepts here that's very important that you'll be hearing a bit about from Ohio today is this idea of financial administrative evidence-based practices. How we allocate and how we expend our resources in public health. Things like quality improvement, or do we allocate money for training? Do we do outcomes-based contracting? And then do we look at diverse funding sources, which in a good body of research now, and especially in sustainability research, turns out to be very important in being able to first achieve an effective program, but also to maintain it over time. You'll also be hearing today from Minnesota about quality improvement. I'm going to change the wording of this one. This one says, here's the new Public Health Bill of Rights. You'll receive top-of-the-line care, promptly and efficiently, delivered in a compassionate and sensitive manner at no cost to you or anyone else. Oh, great. Make this person in bed the public health practitioner. Great, what's the catch? You died, this is heaven. Okay? Well, the reality is we can't achieve these things without any cost. And that's the trade-off in quality improvement, is how we achieve the highest level of public health practice at an effective and efficient levels of cost. And so that's critical as well. And so you'll be hearing about that in just a few minutes. And then the last area, which I think you'll hear mostly from Colorado about this, about implementation of a public health law, but really policy is at the grounding of all of the work we do in public health services and systems research. And just to illustrate that, I put up examples from the turn of the millennium, the top 10 public health achievements in public health. And this is kind of the David Letterman top 10 list. And here's just a listing of 5 of these: vaccination, motor vehicle crashes, safer workplaces, fluoridation, and recognition of tobacco as a health hazard. Every one of these, as well as the other 5, all involve policy at a fundamental level. And so it's very important that we keep that in mind. And find ways to implement evidence-based policy at the state and local level. Another point I want to just put in your minds is how important policy implementation is in involving fields outside of health. This is a framework we've used from John Kingdon's work around policy streams, and it fits pretty well with public health. We've got a problem, we identify it, we think about what the policies are, and then we take politics into account as well, which too often we don't think about. But what happens in Kingdon's work is that windows open and close. And when they open, when these windows converge, we've seen policy change. Sometimes in a positive direction, and sometimes not in such a positive direction. And these theories, and really most of the progress we can make in many areas of public health, will come from sectors outside of traditional public health. Okay? And so the last couple slides here, I want to expand a bit on the policy notion and get us thinking about creative ways, which is kind of the dissemination arm in a way of PHSSR. And that is a little story for you about the relevance of PHSSR in connecting researchers with public health practitioners or with policymakers, okay? So you might have heard this story in some form or another, but it's one of my favorite little stories, where you've got someone up in a balloon, okay? Any of you been in a balloon before? Yeah? Okay, good, this is you. And then someone down below fishing. And I know a number of you have probably gone fishing, right? Or you like to go fishing. Okay, so here we are in the balloon. Person says, where am I? Well, it's pretty simple. You're 30 yards above the ground in a balloon. Oh, you must be a researcher. Hopefully not a public health services and systems researcher, but you are a researcher. I am a researcher. How did you know? Because what you told me is absolutely correct, but completely useless. Now, maybe this doesn't apply so much for PHSSR, but it might. But we have a quick-witted researcher down below. You must be a policymaker. Ah, yes. How did you know? Because you don't know where you are, you don't know where you're going, and now you're blaming me. So, anybody know that story? It's a true story. Maybe it plays out a little differently, but it really is a true story. And so, one of the big gaps we have, and you'll hear a little about it in just a few minutes, is how we connect the research with the policy and how we do it in a very meaningful way that takes into account that really people live in different worlds. We did an article a few years back called Researchers and Policymakers, Travelers in Parallel Universes. And in many ways, even when the intentions are correct, we are traveling in different universes. And one of our big challenges, I think, in PHSSR is connecting those up. And so I'll end with what I think are promising happenings, and this is by no means an exhaustive list, but is a short list. Accreditation, figuring out accreditation, the incentives around accreditation, I think is an incredible opportunity. The idea of finding and enlisting opinion leaders, people who look and act and know the world the way we would know it if we're a practitioner, and figuring out how we can enlist those in the process to move forward the innovations that are developing in this field. And then you'll hear some about this as well, the business case, the return on investment sort of thing. Especially in the policy arena, people care about cost, and cost matters. And in diffusion, that's called relative advantage. How is this an advantage over what I'm already doing, and what's the cost of doing that? In a policy world, that's not only a financial cost, but it can be a political cost.